Hi, I'm Fallon Jordan with Amen University, and so excited to talk about EMDR with you. EMDR stands for Eye Movement Desensitization Reprocessing. So when we're talking about the brain, which has over 1 billion connections, if you have a traumatic experience or a traumatic relationship, series of events that are traumatic, it gets stuck in a certain part of your brain. And so because of the way that the eye and cerebellum are so strongly connected, and 50% of your cells are in your cerebellum, we can use the way that your eyes are moving to dictate where certain painful memories are stored. And unlike talk therapy, we can actually help you heal with minimal to no talking. I love EMDR. I did 5 SPECT scans, 4 after my first, obviously, where I showed the PTSD pattern and then realized I did have PTSD. And after the 4th or 5th scan, doing EMDR and hypnotherapy, my PTSD pattern had completely disappeared, which to me is just a miracle to see it, but then to feel it more importantly, right? Like not being as quick to startle, not getting scared when I get in the car because I'd had a lot of really bad car accidents. When I see certain notifications on social media of someone that reminds me of something bad that had happened with that person, it doesn't affect me as much, but it also gives me a better ability to set boundaries because I'm not in fight, flight, or freeze. I can think through what I want to say, what I want to make for decisions, just a little everyday decisions, and then the bigger decisions getting easier. So one of the cool things about EMDR is that it involves less talking. And so it allows for people to address these really painful experiences in a way that feels safe. And feeling safe and your brain and body feeling safe is the most important thing when we're talking about anything related to health, because as we've talked about with the ACE scores and how the brain and body are connected, if you are going to fight, flight, or freeze, it's causing a lot of other illnesses in your body. So we're making you feel safe with EMDR. And because we are using the eye cerebellum connection and then the right and the left hemisphere communicating properly, we're able to help people get past things. And I know for me, when I was doing my homework in between EMDR sessions, my therapist had me doing a few cool, silly exercises that helped activate my left and right simultaneously, and then helping them create balance. So when you hear people talking about the corpus callosum and like the connection between the left and the right brain, EMDR is one of the best things for strengthening those connections. So I hope you find this helpful. If you're looking for someone, you can always call Eamon Clinics and see if the location near you has an EMDR therapist licensed in your state. You can always go to psychology.com, and you can always also go to emdria.org to find a provider. And I hope to answer your questions next week, so please send them to us about PTSD, support@amenuniversity.com. Thanks so much, and I look forward to sharing more with you soon.